So it's time for another update. Last Tuesday, so it's the 10th of May now, it was a week ago, we went to Middlesbrough and met my surgeon. We actually went on the Monday and stayed over because it's a 4-hour drive from where I am. If you have this and you're driving for a long period of time, I would really recommend lidocaine patches if you've got them, and also a cushion at the front between the belt and your rib cage, and one at the back as well to absorb shock. I didn't have one at the back, but going around sort of corners and over speed bumps and things was really quite. I'm going to take these off because it's the laptop's glaring. Was really quite painful. The drive was really nice because I've not really been anywhere apart from London for the ultrasound, so it was really nice to see like trees and things, the little things that we take for granted. And to go through little villages and just see some different stuff was really good. So the Tuesday late morning, we drove from the hotel to the hospital, which is literally 50 meters away. The hotel was on site, but I couldn't walk that far. The walk from the hospital entrance to the ward was really quite tough, but I got there. So I was very nervous, as you know, because I had all of these thoughts like, what if I can't have the surgery for any reason? What if I have to live like this for the rest of my life? What if, you know, they recommend nerve blocks first? What if all this stuff, you know? There's the term slipping rib warrior, and I've been calling myself a slipping rib worrier because I've been doing a lot of worrying. But I needn't, because you know, everybody told me that Joel would be, you know, a really nice guy, and I knew already, you know, because he'd taken the time to respond to my emails and everything even before I was a patient of his. But he put me at ease straight away. It was the first time in a very long time that I have spoken to doctors that have sat and listened. There was him, there was his registrar, and also a medical student who was in her third year, which I thought was brilliant because, you know, it's that new generation of doctors learning about this condition, which they probably won't be taught about in medical school. So that was a real, you know, something that stood out for me. There was a huge amount of compassion. So he had my ultrasound report and the email that I sent in February, when I realised that my 11th, my 10th, what I thought was my 10th rib was actually my 11th rib, and I realised that there was something else going on. So I didn't have to explain anything. He had that in front of him. I was asked some questions about the pain and how it affects my day-to-day life and sleep and everything. And I'm going to have surgery. And that is, I always hoped that would be the case, but there's a very, very small percentage of people that don't have surgery or can't have surgery for whatever reason, and that was in the back of my mind. And I feel so much better now in myself, mentally and emotionally, knowing that after all of this, you know, if you've followed my journey, you'll know it's not been easy. That there is light at the end of the tunnel, and that it's, you know, we're getting to where we need to be now. I've still had pain. You know, yesterday I was in bed all day. I've been in bed part of today. But it's that little bit easier to deal with because I know that the end is in sight, and mentally I just feel so much lighter. The day after my appointment, when I was back at home, I woke up and I just felt like the world had lifted from my shoulders. Honestly, I just felt so much lighter and brighter, and that hope is there now. It's real, it's tangible, and that's an amazing feeling, honestly. So we've agreed to do the surgery separate, so we're going to do one side at a time. I know that a lot of people in the US in particular have bilateral surgery, so they do both sides at once. And I think that's, a lot of that is because people have to travel a lot more than 4 hours. 4 hours in the UK is a long drive, but to people in the US, 4 hours is nothing. Some people have to drive for like 4 days or fly. So yeah, my surgeon, I already knew from what other people had said that my surgeon was going to suggest one side at a time. And there was a time, I don't know if I mentioned it on previous videos, there was a time when I really wanted to push for bilateral, because I in my head I thought, well, I'd rather have more pain for less time. But I think it's the right thing to do, because I'll be very limited with the help that I get at home, because my partner has difficulties as well. And also it feels like the right thing to do. So even though it will take longer, overall, it will probably be that little bit easier to recover with just the one side, and things like getting into bed and things will be a little bit easier, I think, given the circumstances. So the plan is to use the Hansen technique, to suture, so Hansen 2.0, so we'll take the 10th rib that slipped. I can't show you, but like, say that's the 9th rib, that's the 10th rib, we'll overlap the 10th rib over the 9th, so that it can't rub the nerve, and then we'll suture them together. Suture is just a stitch. It is a long recovery. It's a difficult recovery, so I'm not under any illusion that it's going to be easy, because I know it's not. Because basically the sutures cause irritation and they form scar tissue, and it's the scar tissue that helps to solidify everything in place, and obviously that takes time. And the ribs have to adjust to their new positions, even right round in the back. So it's going to be hard, but it's going to be worth it, I think, because I hope to get. I think I've said on previous videos, even if I can't get to 100%, if I can get to 60 or 80% of how I used to be, I'll be more than happy with that. I know this surgery is still in its infancy, but there's doctors out there that have embraced it, and Dr. Hansen, I know, is working really hard to revolutionize how rib injuries and rib conditions are treated. So yeah, there is hope. The thing that is worrying me slightly is my 11th rib. So you will have seen in previous videos, my 11th rib is very, very, very hypermobile. I feel it moving when I walk. I feel it moving in the car. If we go over a bump or turn a corner, I actually feel the rib inside me moving, and it's really not nice. Getting in and out of bed, 12 gets trapped under it between 11 and the hip. That's what's causing the pain when I'm walking. So initially, Joel suggested maybe suturing 11 to 10. I couldn't really remember all of the appointments, so I sent him an email after just to clarify, and he said he'll either suture the 11th rib to the 10th, or use a neo something, which is what Dr. Hansen uses to loosely tether the ribs. So I've done some research, and I know that They don't recommend tethering the 11th rib to the 10th because 11 should be a floating rib. It's not attached to the ribs above naturally. It's not attached to the chest naturally, and I figured out that if to bend and to twist, we need a little bit of mobility there. I have found a few people in the group that did have their 11th ribs plated or sutured to 10. The ones that had it plated seemed to do okay. The ones that had it sutured were in a huge amount of pain after, had reduced mobility, and all of them have had to have revisions. So, and Lisa Hansen as well, who is Dr. Hansen's wife, she's in the group, and she's explicitly said that that it shouldn't be sutured tightly. So she also said actually that Dr. Hansen doesn't do the other procedure anymore because it causes a lot of stiffness. So I kind of feel like I'm in between a rock and a hard place. I'm not worried about the tens at all. I know I'm in really good hands, and I trust my surgeon implicitly, and I know that is going to work well. It's got really good feedback, but this 11 is something that it's much rarer. In previous instances where people have had surgery on 11, it's normally been where people have costoiliac impingement syndrome, which is where the 11th or 12th rib drops, which can happen sometimes as people age, or with muscle deconditioning. And it touches the iliac crest, which is at the top of the hip, and it's bone on bone. It's very uncomfortable. I'm convinced now that is happening with 12, but I'm hoping it's because 11 is pressing down on it, and that hopefully that will fix itself. Because I have to walk very, very slowly. It's quite a sharp pain. It's bone on bone, and it's not nice. But yeah, I'm hoping that fixing 11 would fix that. I'm sure there'd be an opportunity to go in again and look at 12, or hopefully maybe my surgeon will. I know he's very, very thorough. I've seen quite a few of his operations. He's a great guy, and it's possible that he will look at 12 as well and decide, yeah, that needs trimming back a little bit. I know Dr. Hansen does that, and other surgeons do that sometimes when the 12th rib is hypermobile or too close to the hip. So I sent an email to my surgeon and just said, to clarify the plan for 11, and I've said that I wouldn't really feel very comfortable doing the suturing, given it's the feedback from other people who had it, and the sort of the prognosis. I would be very, very nervous about that. So my options seem to be, leave it as it is, have the suturing, or have it loosely tethered. Leaving it as it is, is there's no possibility of that, because it's really affecting my mobility. It's really affecting me in bed, and I can't imagine spending 50 years in this house. So I know that the results are not necessarily as clear cut with that as with the slipping ribs. But I decided, I need to take that risk. It is a risk, but I need to take that. And if I do have stiffness, it's not as bad as pain. I could deal with not being able to do certain movements. And if it has to be revised, it has to be revised. We might have to go in future and chop it off, but my surgeon wants to avoid resection where possible, which I agree with. So I want to try this first and hope for the best. But I am kind of going into it a little bit blindly, because, like I said, it's something that seems to be exceptionally rare. My 11th rib is not touching my hip. It's come out, it's flared out, and it's impinging on the 10th nerve. I get a lot of pain between ribs 11 and 12, sharp pains, nerve pain, and it's just the feeling of it bouncing around everywhere inside me is really uncomfortable. So we have to do something, and I'm happy to try the tethering, but I know that it may not solve all my problems. I may still have to walk slowly and things, but at the end of the day, I there is a lot of positive to this, and I have to focus on that, because it's the light is at the end of the tunnel, and the it's the beginning of the end now, and I know that my surgeon, he doesn't give up on any of his patients. So even if there are complications or it doesn't go sort of as well as we hope, there will be a way to figure something out. Where am I? I'm just looking at my laptop because I wrote my blog on the website a week ago, and it's just to sort of refresh my memory, really. I think I've covered most of it. So when I was there, I was told that it would probably be maybe sort of about 6 weeks until the first surgery, and then that we would see how that goes, recover from that, and then look at doing the other side, provided we don't need to go back in on the right side. It makes sense for me to do the right side first because that's worse. It's been 5 years with the right side overall, whereas it's been about a year with the left, and because I've got that 11th rib issue on the right as well, it just makes sense to do that first. After my chat with Joel and the other doctors, I was introduced to Robin, who is an acupuncturist, and I was offered some acupuncture. I had that before, I think 2019. But this was when I was getting pain near my spine and shoulder blade, and I thought I had a back problem. This time I had the acupuncture between my intercostal spaces, and it was good. It was really relaxing. Robin was lovely, and it was really. I think it's great that the hospital works with sort of holistic therapists as well, and know that there's a place for alternative therapies, complementary therapies, in relieving pain. It didn't hurt at all. To be honest, the acupressure mat that I use hurts much more, and it was really relaxing. And there may be opportunities to have more acupuncture before and after surgery, so that's good. I do think it helped on the journey home, definitely, because I'd been poked and prodded a little bit, and I'd had to walk a bit in the hospital, and I'd had the car journey the day before, and it was a lot more bearable, the journey home, than I thought it would be. So I really do think that it, as well as being relaxing, I do think that it has released some kind of tension somewhere. After that, no, actually it was before that. I had my pre-op assessment, so I met a nurse who asked me some questions about whether I smoke and whether I have had sort of certain conditions, what medication I take and things. And then I went to another room and saw two other nurses. They did my blood pressure, they took a blood test, they did my height and weight, BMI. They did an allergy test for the antiseptic that they use in surgery as well, and that all went absolutely fine. Nurses were lovely, and I got the impression that everybody I came across, everybody who worked in the department, I got the impression that they loved their job and they loved helping people, and there were smiles and humour, and they were just so lovely. And it's such a breath of fresh air when you've had all these tests and medical stuff and been told that there's nothing wrong with you, that feeling of being taken seriously and being listened to is amazing. Um, it really is. So I know that I'm going to be in great hands when I'm in the hospital, and everybody that's been there and had the surgery has commented on how lovely everybody's been. Um, so that's another really good positive thing. Um, so I was expecting June or July, and this morning I spoke to the coordinator, and I've been given a date for my surgery. It is the 30th of May, which is much, much sooner than I thought. It's in 20 days. Um, so that's really good because it gives me less time to worry because, believe it or not, I never used to worry really about anything. I was always very sort of can-do, positive, um, and I've done a lot of worrying, and I think it's understandable with the journey that I've been on, and I think it's normal. I have had two surgeries before, but they were both emergency surgeries, so I didn't have any time to worry before those. But overall, I know I'm in good hands. I know that we're towards it's the beginning of the end, and I'm on that journey now that I wanted to be on, and it's all. I think all the hard part is over now and behind me. Um, so yeah, I'm going to be preparing for surgery. I might do another video between now and then with sort of the planning. I've already ordered some things like straws and ice packs. The straws are just so that I can drink lying down. I'm a big planner. I plan everything and research everything and organise. It's a big part of who I am. So hopefully I won't forget anything. Um, and yeah, I'm really, really pleased to be able to make this video and to be able to say that I'm there. You know, it's really good. The other thing to say, really, I suppose, is last week this really mainly concerns people in the US. But there was a Chest Wall Injury Society meeting last week in Utah, their annual conference. There were 100 surgeons there from all over the US, some international visitors from Australia, the UK, Brazil, and Colombia. And Dr. Hansen had a chance to chat with some of the surgeons about his procedures, and they took a lot of interest. I know this from the Facebook group, by the way. Um, and they were really eager to learn. So hopefully that list of doctors around the world that you can see on the website is going to expand. I know that in the past couple of weeks I've had contact, from a few people confirming that they've seen doctors who are doing surgery and diagnosis for SRS, and the list is expanding really rapidly, which is great. The other thing is that there are some surgeons in the USA. Those are Dr. Hansen, Dr. Bowman, Dr. Erickson, Dr. Dobin, Dr. Kay, and Dr. Gastner, who will be collaborating in the future to write some papers on slip and grub syndrome. And I know that Dr. Hansen is in the process of writing papers on his reconstruction procedure, as well as some like statistics and things from previous surgeries. So it's more good news about this condition getting out there within the medical community, which is really, really good to see. That's it from me, and I'll probably have another update soon. And I plan to, once I've had the surgery, I plan to probably do a weekly vlog. I know that Logan Alucci's videos were really helpful, and Josephine Ljungqvist's video, she did some videos about after surgery as well. So I think it's really good for people who are looking at having the surgery to see those, and it's been really helpful for me to see other people and their experiences. And I suppose it's nice to see people who are on the journey, healing. and sharing that. So I look forward to being able to update everybody in due course, on the journey to finally getting fixed.